On average, only 12% of patient illnesses are correctly diagnosed by primary care providers.
Which means that 9 out of 10 are given the wrong diagnosis?
Yes.
Oh, man.
Medical errors are actually the third leading cause of death in America. 1 in 3 misdiagnoses lead to serious injury or death, and these screw-ups cost the economy billions of dollars.
And tinnitus is another one. I hear this noise in the ear. Could be two things, either wax in the ear or there is a swelling in the nerves. Otoscope. This has a little tube here. So ask so many doctors, nobody knows why that tube exists. Without that, killer wouldn't have got a panic. Why? Because looking in the ear and saying red ears is nonsense. As I told you, any inflammatory response, whether infection or just screaming loud or crying, can produce redness because the circulation increases in the membrane very fast. And that too, on the top of it, I see the notes. I've done a lot of research to find out all this, okay? It's not one day job. I'm talking without preparing. I've just got this slide that just brought it down, just to make it more interesting. But none of these I have prepared. So I see this all the time. The doctors putting it in, because there are ear infections, red ears, wax plus. What does it tell me? Whether the doctor knows what he's talking about or he's a useless fellow who's simply teaching out antibiotics. Why? Because if the ear is inflamed, as I said, one of the things in inflammation is heat. It's just like putting a butter on a hot pan. If there is inflammation in the ear drum, it is hot. The wax will melt. You will never see a drop of wax in your ear. They use it wax rate. Antibiotic. So you don't need to look at the ear at all, really. Why? Because looking at it, you have to use this to diagnose it. Nobody has ever seen it. In UK, I've never seen it in any surgery. I'm the only one who's trying it. This is going to be anti-cutting, 40 years old. So you have to attach that, you put it in a pump thing. When you pump it, the eardrum will move in and out. That means it's normal. It doesn't move out, but there is no pain. That's blue here. Something is obstructing from this side. And it doesn't move, but it produces severe pain. That is infection because it's like an abscess. The pain is present. Okay? That's the only thing. 0.01% of the people have that. So if you can't get the otoscope, don't worry. Just get one of these. It's a tuning fork. There's a test called Weber's and Rainey's. Yeah? You click it like that, keep it on the head. Like that. And you ask the patient, do you hear equally on both ears? He says yes. Or you can say, no, I can hear it louder here, not here. Okay? That means to say there's something wrong here. So you do the same thing. Press it hard here. Can you hear it? Yes. So you wait till it go away, because if you do it like that and say, which one is louder, they can't make out. So I want to know whether this is louder or this is louder. Okay? This keeping here is air conduction. The noise is going through the air. This is bone conduction, going through the bone. Nowadays you can get speakers, you put it on the bone. Yeah? So if air conduction is lower, then there is a block. There might be a wax, or he's got some other problem inside the ear. So bone conduction, he needs to go to the ENT people because he needs to do the special test to see whether there is deafness altogether. Okay? So if there is infection or a wax, anything like that, it's just ear. Both ears are infected at the same time. That means it's likely to be virus. As I said, bacteria doesn't know how to get into the cells. It's got in here, but it doesn't know how to go from here to there. So it will only most likely infect only one ear. The infection with antibiotic is 1 year, and then they usually have mild temperature or feeling hot and cold. So ear pain associated with hot and cold and reduced air conduction is likely to be otitis media must help with an antibiotic. If both ears are infected, it's virus, because as soon as the virus gets in, it gets everywhere, into the head, into the skull, into the bone, everywhere. It's got no barrier. It just goes through every cell, like that. So virus infection is everywhere. Bacteria is usually localized. Okay? Any questions? We are trying to rush through before you all fall asleep.